Hi guys, I'm Nurse Teena. I am the owner of Hibiscus Oasis. It's a wellness spa here in Austell, Georgia. And today we are going to be talking about 5 things that can cause an infection after surgery. Stay tuned, like, comment, and subscribe. All right, let's get into this video. So one of the reasons that you can develop an infection after surgery is if you are a smoker. If you are a smoker, you want to try to quit at least a month before your surgery, and you don't want to smoke for at least 6 weeks after your surgery. Those first 6 weeks are very crucial. And what smoking does, it causes your blood vessels to constrict. If your blood vessels are narrower, that means that your red blood cells and your white blood cells are not able to travel to your incision site. And you're also not getting enough oxygen to go to that incision site to cause it to heal. When you have poor wound healing, you create a space for bacteria to creep into that wound and cause an infection. So a second way for you to develop a post-surgical infection is by having your wounds reopened. I know a lot of people after cosmetic surgery, they like to go and get their lymphatic massages, and at that time when they have a buildup of seroma fluids, their technician may decide to reopen those incisions to help with the drainage. The only person that is supposed to be reopening those wounds is the surgeon that made them. Do not allow anyone else to reopen those incision sites. Doing so may cause bacteria to creep in, which can make you end up in the hospital if the wound gets super infected, where they need to clean it out a couple of times, and also put you on long-term antibiotic therapy, and you're gonna be in a lot of pain. So let's avoid all of that, and only the surgeon is to reopen your wounds. Our third way, we are gonna talk about BBLs, which is the Brazilian butt lift. So it is very important after having this surgery for you not to sit or lay on your butt or hips for the first 6 weeks. Doing so will cause something called pressure necrosis, which is almost like a bed sore at the area. It's going to cause the tissue to die off. And when that tissue starts dying off, you're going to have to go back into the doctor, and they're going to have to debride the whole area to get rid of that dead tissue, which is kind of cleaning it out. You're going to be in a lot of pain. You're going to need antibiotic. You're going to need to be hydrated. It's going to be a long healing process. So we don't want to waste our money, and we don't want to put our body through that unnecessary stress and developing an infection in the area. So the best thing to do is not to sit or lay on that area for the first 6 weeks. So our number 4 way that we can help prevent a post-surgical infection is by preventing constipation. Your bowels are going to slow down because while you were under general anesthesia, they gave you a whole bunch of narcotics that's going to contribute to that. And then when you're out of surgery in recovery, they're going to give you more narcotics again to help with the pain. And then when you go home, you are now taking more narcotics to help relieve the pain. So now you've had a triple dose of narcotics in your system that is going to help slow down your bowels. One of the ways to prevent that is by getting up and ambulating. That we always say at the hospital, ambulation is the key to an early recovery. So you definitely want to make sure you get up and walk, and make sure that you are wearing your compression socks to help prevent DVTs or blood clots. You also want to include some stool softeners. You want to make sure that you drink a lot of water, or you can call your nurse to get your IV hydration. So call me. You also want to take, there are also fiber supplements that you can either mix into your juice or your water, or you can take the gummies. I take the gummies on a daily basis. They're so much easier to go down. for me, and I don't get to taste the powdered form. And another reason why it's very important to not become constipated is because sometimes with the narcotics, you can end up developing an ileus after surgery. And ileus is when your bowels stop performing that wave-like motion that helps to push the stool through your colon. So it becomes impacted there. So when you develop an ileus, you may notice that you start having a fever greater than 100.4. You might notice that your abdomen becomes very distended. You'll feel queasy. You might have some nausea and vomiting, and you just can't keep anything down. Once you go to the doctor may listen to your belly. He may notice that you have no bowel sounds, which means nothing is moving in there. So now you have to go back to the hospital to try to get those bowels to clear, because if your bowels don't clear, they can end up being perforated or bursting open, and now that's a life-threatening emergency. And also, while you're there, you're not going to be able to eat anything for about 24 to 72 hours while the doctor is waiting for that to resolve on its own. So an ileus is a very, very serious thing. So you do not want to develop that. So you want to make sure that you are taking your stool softeners, you are adequately hydrated, take your fiber supplements, and make sure that you are walking. Get up and move. I know it hurts, but we have to take the medication and get up and move. Okay? Okay, and so our number 5 reason how you can develop a post-surgical infection is by consuming alcohol. So I know we love our alcohol, but when it comes to surgery, we're gonna have to stay away from that alcohol at least a month before we go in for surgery, and at least 6 weeks after surgery. Longer if you're able to make it. So what alcohol does is alcohol can decrease the effects of the medications that you're given during surgery and after surgery. Or alcohol combined with certain medications may make you have a bad reaction, or it may make the drug work stronger than it needs to be, which can then cause harm to you. Another thing that alcohol does is it can cause excessive bleeding, and we don't want that, because then you are going to have to go back in to find where the bleeding is coming from, and that can be life-threatening. Another thing that alcohol does is it inhibits the body's immune response, and it also slows down your wound healing. And if your wound healing slows down, then that means that bacteria can definitely find its way in, and now your body can't fight it off. And if your body can't fight it off because your immune response is so decreased, you can end up with sepsis or septic shock, and that is a very serious thing that can kill you. So definitely want to stay away from the alcohol, and definitely so it can give your body a chance to heal and give your body a chance to fight it off. So that was my top 5 things that can cause a post-surgical infection. I look forward to seeing you in our next video. Make sure that you like, comment, and subscribe. And also go and follow me on Instagram at Hibiscus Oasis IV. That's Hibiscus Oasis IV. I look forward to sharing more information with you guys.